This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
I'd say one of the things that, is kind of fun is taking care of acute joint injuries like shoulder dislocations. And I think a lot of us kind of feel like a little challenge to see if we can get them in kind of quickly without sedation. Sometimes you can get a joint reduced, shoulder reduced pretty quickly, sometimes even out in the waiting room. And there's a lot of different techniques that we use, and some of them people tolerate better than others. And there's a lot of different ways to reduce shoulders. And, every so often they come out with a slightly different variation. Sometimes it's easier on the patients. And there was one I read about very recently that's just a new variation of a reduction attempt. And they call it a kind of wrist clamp shoulder lift. And the way it's described is to have a patient just sitting in a chair. They don't need to be in a gurney. One person can do it. And you kind of start out with their arm at their side, and then you slowly pull on their arm and kind of lift it out to the side. So like 90 degrees of abduction and then 90 degrees of external rotation. So it's kind of shoulder out to the side and kind of thumb up. So you kind of gradually get them there. Sometimes you have to do it slowly if they're hurting, kind of take a break and then slowly get them up there. And then after you get them there and they're a little relaxed, you actually kind of drop their arm down to about 45 degrees of abduction. And then, this is interesting, the person doing the reduction, because they're by themselves, holds the wrist in between their knees, so your hands are free, and then you use your hand kind of in the axilla to kind of guide the humeral head back into place while you're holding that traction. And in the study, kind of where they reported this, they had 36 patients. They were able to get them all back in without any medication, so no analgesia, no sedation, all sitting in a chair. They had no injuries, no problems, single provider. So, very promising kind of initial report. It's just one study. It'd be nice to kind of reproduce this. But it seems very safe, seems like something you could try. And, all of us that work in the emergency department like to maybe take what we do to out on the street sometimes. So if you have somebody who, dislocates their shoulder, it's something that you can definitely try to get someone's shoulder back in, and something we can do here. So thanks, everybody. Have a good night.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.